One of the key questions around dermal fillers is their safety. Now, the product itself, generally with dermal fillers, is based on what's called hyaluronic acid, which is a substance you find within your own skin. This is changed by cross-linking to make it last longer. So the types of things that you tend to find with dermal fillers, you can occasionally get allergic reactions, and sometimes these are immediate, but more commonly those would be a longer term, sort of a couple of months down the line, where the body starts to react. The other things with a dermal filler, because it's solid, you've got to be very careful where you place it, because if you place it in somewhere, you can block, say, a blood vessel in the face. And if that were to happen, then obviously that then has complications. Most of the dermal fillers with hyaluronic acid you can reverse if you need to, so you can get yourself out of that. But the key thing around these sort of things is that these sort of side effects are not common, but they're known. So we have to be aware of them, and when I'm treating you, I'm always thinking about, right, the anatomy underneath, what's going on, to make sure that I'm being as safe as possible. And then I'm looking afterwards to make sure that actually there aren't any obvious side effects, and that if any of these side effects occurred, we could immediately treat them. These are rare. The worst thing that's known from some dermal fillers, especially when you're treating around the eye, is blindness. But the chances of that reported in the literature is about 1 in a million. So it's very rare. But we have to be honest and say it's not risk-free, and you need to think about, do I want to take this sort of risk or don't I?